Another eating disorder is anorexia nervosa, something you probably heard of. You probably just call it anorexic or anorexia. It's an eating disorder characterized by self-starvation leading to extreme weight loss. So the word comes from a Latin term meaning nervous loss of appetite, so the nervosa part of it. It's most common in females ages 14 to 18, but that doesn't mean that it cannot also occur in males. Again, these people suffer usually from low self-esteem and poor body image. They eat less and less, and then they exercise a lot because if we consume less calories and burn more calories, we'll be super, super skinny. Again, not the healthiest thing, because if you don't eat enough, you're not getting enough nutrients, you're not getting enough fat. It's very dangerous, and these people usually look too skinny, kind of characterized by a lot of bones and being bony, but these are the people that, again, would just drink lots of water or go to a restaurant and not eat a lot and pick at a salad maybe. Try to act like they eat, but they just probably don't eat a lot in their spare time and do a lot of exercising to burn more and more calories. Even though they may be dangerously thin, they may still see themselves as overweight, so they might look in the mirror and still see an unhealthy, or what they view as being unhealthy. Most of us would view it as being healthy, but again, with society's image of what beauty is, it's people thinking they need to be stick skinny and, have abs and not a lot of things that shake on them, body fat. They can become underweight and lack the proper nutrients for the body to grow and repair itself. So again, being underweight just as dangerous as being overweight. You don't have a lot of nutrients, your body's gonna not be able to grow and repair like it needs to, so all that exercising, if they were to become injured, it would be very hard for them to, repair that body tissue because they are not getting the nutrients that their body needs. They can die from starvation, heart failure, kidney failure, and other medical complications due to the lack of nutrients. And then it can eventually lead to depression or suicide in extreme cases. These people usually end up getting help in facilities or other things, but usually a therapist can be just as helpful. The next one is bulimia nervosa, similar to anorexia, but this is a condition in which a person eats large amounts of food and then will secretly purge, meaning throw it up later or soon thereafter. This primarily affects female teens, but again, men and males can still get it. About 1 in 10 people affected are male. The purging happens usually by vomiting, or you can take laxatives. It's got to come out one way or the other. Vomiting would obviously prevent it from being digested through the body, at least going the other way. The people are getting some sort of nutrients. They may also exercise in order to burn off calories that they may have eaten. So they don't want to gain weight or have extra calories, so they're going to possibly exercise a lot also to avoid that. They're concerned with weight loss. They do not usually become extremely thin because when they're eating the food, some of it is going to get digested into the body, so they're not completely eliminating all nutrients. So this is a little harder to notice, but usually there are some other side effects that come with the vomiting side of it. So going to the bathroom immediately after eating a large meal so that they can throw it up. I don't know anyone that enjoys throwing up, but Apparently they still want to eat the food, they just don't want to consume the calories, or they want people to think that they're eating. They could also hoard the food in their mouth and go to the bathroom and then spit it out instead of vomiting. But they might run water to cover their sound, because usually you can tell if someone's throwing up. They could also have swollen cheeks because of the vomiting. Their throat is going to be sore from the stomach acid. Their teeth could also end up getting eaten by the stomach acid and throwing up, and they could have really bad teeth from this. So it's not something that has good health effects. Again, health problems, stomach acid eats away at your teeth. It can injure your mouth and your throat. It's going to cause hormone imbalances, obviously dehydration, because when you puke, you're getting a lot of water up also that you need. And you're going to have damage to the kidneys because we're not getting enough water, we're not getting enough things filtered, and your liver. And of course, you have loss of important minerals that your body needs. Again, you need fat, you need calcium, you need carbohydrates, but if they're not consuming enough food and just purging it, then they're going to lack a lot of minerals that they need. Who can help people with eating disorders? Counselors would be probably the first step to see if they could get help. My child just wants to talk. I'm trying to record. I'm almost done, okay? Just be quiet a little longer. It's fine. A primary care doctor can also help them get on track and give them more, numbers. Say, here's your body mass index, here's the nutrients you're lacking, and give them kind of a visual of what they're doing to their body and why they should stop doing what they're doing. Addie. All right, now. A nutritionist can help get them back on track to getting enough calories and saying, hey, you're not getting enough of this in your diet, so let's slowly introduce this like this. We don't want people with eating disorders to start consuming normal amounts of food right away, just like we don't want people that are alcoholics to stop cold turkey because their body could go into shock. So we're going to slowly introduce things into the diet, help them. Obviously, the counselor can really help them rebuild their physical, mental, and emotional health, because if that is not cured, then the eating disorder will just come back. So having them be happy with their bodies and know that, it's healthy to, weigh a certain amount. I could weigh the same amount, but have more muscle. I could weigh more because I've had more muscle. If these people are working out, then they're obviously going to see some weight gain if they're gaining muscle. So that would cause them to maybe eat less, which we know is not good. Again, they might be hospitalized for severe depression, or they could go to a treatment facility if they know that, just seeing a nutritionist and saying you need more of this in your diet won't help them. They can go somewhere where someone's monitoring them 24/7 and helping them get back on track to a place where they can do it on their own. Kind of like the same with people that go to rehab for drugs and other things like that. Fad diets I will put on part 3.